My name is Dr. Patrick Reeves, and I'm a Pediatric Gastroenterology Fellow at the Walter Reed National Military Medical Children's Center in the Division of Pediatric Gastroenterology. Today, we will discuss the basics of recognizing constipation and how to use your constipation action plan at home to be more confident. Constipation is a chronic problem that is often the result of something called withholding behaviors, wherein the child does not want to defecate or uses poor posturing while on the toilet, leading to infrequent bowel movements or very large poops that can be distressing to the child when they're eventually passed. The Pediatric Bristol Form Stool Scale was published in 2019 as a tool that both children and parents could use to grade the caliber of stools, with type 1 being evident of the most constipated stool possible, and type 5 indicating watery stools consistent with more like diarrhea. While we know that there can be multiple possible causes of constipation in children, functional constipation is often the result of poor posturing and other concerning behaviors that impede the outflow of stool during pooping times for children. Primarily, we can make appropriate lifestyle changes by improving the posture of children using things like potty stools and scheduled toilet times to encourage easier passage of poops into the toilet. Now that you and your physician have agreed upon the types of medications to use in the therapeutic treatment of your child's functional constipation, let's talk about the Constipation Action Plan. The Constipation Action Plan is divided into 4 main sections. At the top, you'll see that there is a clean-out section. This is used when children have a large stool volume in their colon and are referred to as backed up. The clean-out is similar to what is used for colonoscopy clean-outs in an attempt to flush the intestine and flush the colon and empty it of stool so that it can return back to its normal size. The next preceding sections are used to help you determine how bad or how good your child's constipation is being managed at home. The green zone is the good phase. This is what we want children to be every single day. As you can see, the pictures and words that describe the pictures are all supposed to help guide you in the management of your child. The goal would be for the child to have 1 soft stool every day, to have normal play, normal appetite where they're eating their meals, and to not have any signs of pain. You can see in the medication section that there is an everyday medicine column followed by how much, how often, and other comments for things like mixing the medicine powder in a glass of water. Please be sure to review these with your physician prior to leaving the clinic. If your child worsens in their constipation, they may demonstrate things to you like abdominal pain, decreased appetite, or not pooping for 3 days or more. These are all symptoms that would show you are in the yellow zone, and your physician will already have filled this out to show what the next step up in therapy should be. It's important to keep in mind that some labels on the medicines prescribed to your child may only reflect the green zone, but if you take this plan home and use it properly, you will see when to increase the medication dose or when to use a different medication altogether. Finally, the red zone shows you the most concerning side of constipation and how your child's abdominal pain or lack of appetite or an inability to poop may be concerning. This is the final level that parents should use in the treatment and triage of their children, and you should always get in contact with your physician if you get into the red zone. Thank you so much for listening to our Constipation and Constipation Action Plan education video. Have a great